Hello, child welfare professionals! Did you know that Health First Colorado for children under age 21 covers more services and benefits than it does for adults? That's right. And for the children and youth under your care, it's crucial to be aware of them. Because understanding these benefits makes it easier for you to access and advocate for these free essential health services, ensuring that the children and youth you look after receive comprehensive care for all aspects of their health. These benefits are provided through a Health First Colorado benefit called EPSDT. EPSDT stands for Early and Periodic Screening, Diagnostic, and Treatment, and it's already part of children's Medicaid Health First coverage. In this video, we're going to talk about what EPSDT is, what it covers, and how child welfare professionals like yourself can use it to provide comprehensive support for children and youth under your care. We'll also hear from a family that has benefited from EPSDT and talk about the next steps to take advantage of all these extra health benefits that are available for youth in your care. Let's get into what EPSDT is and what it covers. First, it's important to know that EPSDT is Medicaid. Once you have opened a Medicaid entitlement span for these children and youth, they will automatically qualify for the EPSDT benefits provided by Health First Colorado. So what exactly is EPSDT then? Let's break it down. E stands for early, assessing and identifying potential health problems early through regular childhood health assessments and screenings. P stands for periodic, checking youth's health at periodic age-appropriate intervals. S focuses on screening, providing free physical, mental, developmental, dental, hearing, vision, and other screening tests to detect potential problems. Early periodic screenings are required for all children who are on Health First Colorado. So if a child is under your care, it is your responsibility to help ensure the child gets this care. Now here's a really important part that many people miss. D, diagnostic. That is, performing diagnostic tests to follow up when a risk is identified. This ensures that if a healthcare provider thinks there's an issue with the child's health, they get additional tests to figure out what's going on. And T, treatment, is about controlling, correcting, or reducing any health problems found. Or to put it another way, EPSDT provides supplemental healthcare services to keep youth healthy, identify other acute healthcare needs, and treat the conditions that fall outside of standard Health First Colorado coverage and benefits. Here are some examples of supplemental healthcare services that are available through EPSDT. New eyeglasses and dental services as often as medically necessary. New or replacement medical devices. Behavioral health therapies. Higher levels of medically necessary care, and much, much more. If it's necessary to prevent or treat a health condition, EPSDT covers it at no cost to the family or your organization. If the required care is unavailable within Colorado, but determined to be medically necessary, it must be provided, including looking at enrolled providers out of state. Now let's talk about who can access the EPSDT benefit. Here's the good news. There are no additional applications or requirements. EPSDT is for all children and youth under age 21 with Medicaid eligibility. If the child is covered by Health First Colorado, they already have the EPSDT benefit, even if they also have additional private insurance coverage. Now, even though EPSDT covers a wide range of healthcare services, it's important to understand that not everything is included. The general rule is that if the care directly supports the child's physical or mental health, it will be covered by EPSDT. But some things that aren't directly connected to physical or mental health, like tutoring or experimental or unproven medical treatments, are not covered. Sometimes the healthcare provider may need to get pre-approval from Health First Colorado before they can provide these services. Other times, no pre-approval is required. But don't worry, the healthcare provider will work with Health First Colorado or other healthcare partners to take care of these pre-approvals. We cover this process in more detail in other training videos. When the child's healthcare provider recommends a specific treatment, test, or service to address a health issue or to prevent a potential health problem from getting worse, they occasionally also have to prove that the care or treatment is a medical necessity. Medical necessity means something that directly prevents, finds, fixes, or reduces pain, suffering, or effects of an illness, condition, injury, or disability. We know it can be frustrating, and it might take a little extra time for the provider to get pre-authorization and provide proof of the medical necessity. But it's a required step to get these services covered for free by EPSDT that the child might otherwise go without. Let's go through some examples. Based on what you've just learned, do you think this would be covered by EPSDT? A child has recently come under your care and they need to be admitted to a psychiatric residential facility. Unfortunately, facilities in Colorado are full at the time, and the child needs to be referred to care outside of Colorado. Would EPSDT cover out-of-state care? Yes. If medically necessary, out-of-state psychiatric residential facilities would be covered by EPSDT if not available in Colorado. Let's try one more. A child under your care needs to regularly be transported to health appointments. However, the child is unable to sit up and requires a specialized car seat to be safely transported. Would a specialty car seat be covered by EPSDT? Yes, specialty medical equipment, including car seats, would be covered. If the child outgrew the car seat, a replacement would also be covered within the same year, so long as it's still medically necessary. Now let's hear how a fellow child welfare worker uses EPSDT to help a child in their care.
My name is Nicole Drake, and I work for the Colorado Department of Human Services, the Division of Child Welfare, and my role within that organization is the Youth Services Specialist. As I think about the young people that I've worked with, I have seen young people get a second chance. One of the young people that we helped get access to EPSDT benefits was a young man who was 9, and he had a complex set of needs. He had intellectual disabilities and delays. He was requiring a lot of services and support that were not accessible in the state, and so he was able to get those benefits out of state and utilize the EPSDT benefit in doing so. Getting the care doctors recommend for children in our care can be difficult. It takes having the right agencies involved, which often includes local regional accountability entities and their case managers, as well as child welfare and other staff involved with the young person to make sure the doctor has the best information about the young person's presentation and behaviors so they can make the best recommendation. The most important tip I would share with families and with professionals looking to navigate EPSDT is to connect with the regional accountability entity that is assigned to the young person to make sure you have a care manager. They will help you to navigate the resources. One of the things that people may not know about EPSDT is that it really is a benefit that is meant to be flexible. It's meant to be able to meet the needs that have been unmet, to discover what else could support a young person, and without it, young people may not have access to the things that are going to help them to grow and develop into the best versions of themselves.
The experience of this child welfare worker highlights the positive outcomes EPSDT can bring to the children in your care. Check out part 2 of this training to see how to make a request for EPSDT benefits and find other resources for child welfare professionals at hcpf.colorado.gov. Together, we can make sure every child's health journey is one filled with support, understanding, and the right resources. For more information, visit hcpf.colorado.gov.